Mr. Manager, I'll let you know as soon as we're live and you can start.
Okay, thank you.
All right, we are now live on YouTube.
Very good, thank you. First of all, I want to say good morning to everyone, and I hope that most of you got some rest last night. I know the staff was up pretty late, and Martha was up pretty late, and we are prepared for our discussion today. Commissioners, I just want to take this opportunity to just sort of very quickly say yesterday was an opportunity for us to get a chance to sort of take a look-see at the economic outlook that's coming down the pike and what we tend to utilize in respect to planning for our future or the ensuing budget. We also took an opportunity to look at our financial solvency as well as the budget outlook and some outstanding critical policy issues. Today, we're going to sort of continue down that path. We have a discussion on first this morning around Medicaid transformation. Obviously, there's been some emails floating back and forth about Medicaid transformation, and you've heard a little bit about it, most of you, and subsequently, given the selection that has been made by the state. The Medicaid transformation not only has implications for our social services department, but it also has implications for our public health operations as well as our emergency medical services. And so this morning we'll get an opportunity to talk about that a little bit and subsequently hear from staff. From there, we will get into some subsequent deeper budget discussions. You were asked last night, last evening, to provide the facilitator, Martha, and Claudia with your priorities. And so subsequently, the staff has spent a good portion of the night trying to sort of package those for a discussion this morning, in hopes that we can have some good insight about what your priorities are, and just as importantly, to talk about where we think we might be in respect to the appetite or the temperature for a respective tax increase in light of you knowing what you know right now, given the financial situation. So that being said, I'm going to go ahead and get things kicked off. I'll ask Martha to give us our orders for the day, and then we'll get staff going.
Mr. Manager and Martha, before you start, I communicated that I have another call, another Zoom at 12, so I'll need to jump off no later than 11:30 to get ready for the next call.
I think we're scheduled for exactly 2 hours and a half, and so it is our intent to be wrapping up at 11:30.
Cool, thank you.
Mm-hmm.
Exactly. And if I could ask either Keith or David to just put up the slide with the agenda, if that would be possible. And I'm always a great fan of saying the agenda is an intent of, we may tweak it a little bit on the time, but it is, as Wendell Davis said, we're going to, after we finish hearing about the Medicaid transformation, we're going to get into policy review. Staff culled a number of things from the materials the board sent last night to highlight some major policy issues. We will be looking at the budget guiding principles and framework and making sure that those things remain valid and on target. Again, that if the staff is like your financial advisors, that's just making sure that they understand your direction. In that discussion, I would expect that tax policy will come up, and then perhaps about 11 or shortly after, discussion or revisiting of board priorities, leaving us some time for reflections and next steps. So that is the intent for the day. And we have a very full agenda. I start from a place of gratitude and abundance, abundance of good ideas that hopefully we can focus as we move on today. So not wanting to take more time, we're now ready for, if Joanne will introduce the speakers on Medicaid. We've kind of shortened that time just a little bit, hoping to wrap up by 10, leaving time for board questions in that. And so I'm going to turn it over to Joanne to introduce our speakers.
Good morning, everyone. Good morning, Martha. Good morning to the commissioners and the manager and everyone on the call. Just want to say that we're excited to have Melanie Bush on the call from the state. And she is here to provide just a brief overview of Medicaid transformation. We know that at some point the work had paused, but we're back moving along with that. And we also have representative from DSS, Social Services, and from Public Health within our county departments, so that they're here as well. But I want to leave enough time for Melanie to share with you and then entertain questions. So thank you. And without further ado, Melanie, thank you.
Thank you, Joanne. Should I share my screen, or is someone going to pull up my slides? I can do it, I think.
No, it should be up already. Do you not
Yes.
see the Medicaid transformation slide?
We still see the agenda, Keith.
Well,
Yeah.
that is interesting. Okay, hold on just a second. Let me stop my share. We'll restart this.
All right, well, while you're pulling that up, thank you all for having me this morning. My name is Melanie Bush. I am the Chief Administration Officer at North Carolina Medicaid. In that capacity, I handle day-to-day operations, including member and provider services. And I also help oversee the implementation of Medicaid transformation. So thank you for having me. I'm going to give a high-level overview. I'm happy to answer any questions at the end. So next slide. So I think Joanne mentioned it. We have been doing this Medicaid transformation effort for a couple of years now. We originally awarded the contracts in February of 2019. But throughout this entire process, we have had a vision for Medicaid transformation. It came out of legislation, but this has really been our guiding principles at the department to improve the health of North Carolinians through an innovative, whole person-centered, well-coordinated system of care that focus on medical and non-drivers of health, non-medical drivers of health. There's been an emphasis over the last several years to not focus on healthcare just as what happens in a provider's office or in the healthcare system, but really focusing on what happens outside of the healthcare system, where you work, where you live, where you play, those drivers of health. Next slide. So these are what we are focused on, whole person care. Right now, our Medicaid program, we provide physical health services on a fee-for-service basis. And then we have a separate behavioral health delivery system that is managed care. So we have two systems. We're really focused on bringing those together and having integrated physical and behavioral health care. We want to meet those unmet social needs, what we're calling healthy opportunities. So people who are food insecure, housing insecure, who may be at risk for personal safety. Those are the things that we are working on making our health plans address, screen for and address through our managed care program. We want our primary care and local care management to be at the local level through providers that our beneficiaries see and know, so that it's personal and people are invested. We want to align our payments with increasing health outcomes and reducing health disparities. So we have provided incentives for providers, paying them for what actually works. And then, of course, the legislature, when they wrote the legislation that made us move to managed care, is really focused on budget predictability. So we will be paying our health plans a set per member per month, and they assume the risk of managing care through that payment mechanism. Next slide. So what are our day one goals? We really just want a seamless transition. Our day one goals are that beneficiaries can receive care on day one and that providers are paid on day one. We want this to be seamless for our beneficiaries. We also want this to be seamless for our providers. We want Additionally, we want people to be able to get their scripts filled. We want beneficiaries to know who their health plan is and they have the right information and they know who to contact when they have questions. We want to make sure that the health plans have a sufficient network. That's actually something that we will do long before day one. We are monitoring network adequacy of all of our health plans on a monthly basis to make sure, and that will be something that we will determine whether they can go live or not, is whether or not they have enough providers to meet the needs of the beneficiaries assigned to them. We want to make sure that we don't lose providers who don't want to participate in managed care. And then we want to make sure that folks are getting their calls answered and getting the information they need. Next slide. So we do have challenges. Like I said, we started this back in February of 2019. We live in a much different world now than in February 2019. COVID-19 has kept everyone at the Department of Health and Human Services very busy, and I'm sure it has at your local health department as well. That has implications for provider contracting. We do need some legislative changes, and getting things through the legislature is sometimes a challenge. And then we were paused, as you remember, because of state budget issues. We didn't have the right budget at the right time, and so that put us into a period of suspension. We did get legislation last summer where we restarted our transformation activities and we got a budget in place for this year. But July 1st starts the beginning of the next fiscal year, and so we're still going to have some state budget issues to work through. Next slide. So COVID, of course, has an impact on all of our providers. Immediately, the impact was that people stopped going to the doctor or to hospitals because we were ordered to stay home, and that was the right thing to do. But providers had a significant impact to their bottom line. And so we did a number of things at the Medicaid program to try to shore up our provider community. Now they've moved on sort of from that, and now we have providers dealing with providing healthcare to folks with COVID, or providing testing or vaccine administration. And so contracting hasn't really been their priority, which is completely legitimate. We want COVID-19 to be their priority, but that is sort of affecting the rate at which providers are signing contracts with our health plans. So that's something that we are keeping an eye on. Like I said, we monitor this on a monthly basis. We do have standards that they have to meet before we will allow them to go live. We're also working, even though managed care is sort of managing the relationship between a provider and the health plan is a private contract, and we are not involved in the state. We are convening work groups so that we can get the health plans and the provider communities talking and working out the issues that are barriers to enrollment. All right, next slide. So approximately 1.6 million out of our 2.5 million Medicaid beneficiaries are transitioning to managed care on July 1st. Those are primarily families with children and pregnant women. Beneficiaries will have 5 health plans to choose from: AmeriHealth, Caritas, Healthy Blue, United Healthcare, WellCare, and then Carolina Complete Health. That is a provider-led entity, and they are limited to regions 3, 4, and 5. We have 6 regions total. Durham, of course, is in region 4. We also will be launching the Eastern Band of Cherokee Indians tribal option, which is a managed care, primary care case management program for members of the Eastern Band of Cherokee Indians and IHS eligibles that live in Cherokee, Graham, Jackson, and Swain and Haywood counties. All of these are going live at the same time. Originally, we had tried to phase in managed care. Now we're doing what we call the Big Bang. Everybody's going live on July 1st. Next slide. So how are beneficiaries selecting these health plans? Well, per federal regulation, we are required to contract with an entity that has no connection to the North Carolina Medicaid program or any affiliation with any health health plans. So they are a neutral party. And we're calling this our enrollment broker. We have a contract. They are providing choice counseling for beneficiaries, walking them through the process, making sure that they're selecting the plan that makes sense for them and their families. They provide a number of services. They do outreach, which of course looks different now that we have COVID. At last go around, we did have enrollment broker representatives in the county DSSs. They have a call center where beneficiaries can call and they can select a health plan on the call center. Outreach materials, which should be on their way to local DSSs. They have a website and a mobile application that allows for beneficiaries to select their health plan either online or on their phones. We have a provider and health plan lookup tool. Providers are using this right now to make sure that they are showing up and displaying correctly, to make sure that they're showing up that they've contracted with the right health plans so the beneficiaries can make the right choice. And then enrollment materials. So each beneficiary will receive a packet from the enrollment broker that will include information about all of the health plans and instructions on how to select the health plan that is right for them. These are actually teed up and ready to start being mailed out this weekend. So we are on the edge of it all beginning. So those are slated to start rolling out on March 1st. We do have a portion of our population that will be staying that aren't moving to the standard plans on July 1st. Our regular Medicaid program, we're now calling North Carolina Medicaid Direct. That's still our fee-for-service program, and beneficiaries will still receive behavioral health services through our LME MCOs. And then starting on July of 2022, we will be transitioning some of that population into our behavioral health IDD Taylor plans. I will talk about that in more detail at the end of this presentation. So let's just keep moving. So this is a timeline of activities that you should be aware of. So soft launch starts on March 1st. Soft launch is really kind of like a soft opening for a restaurant. We're sort of sending out enrollment materials to beneficiaries. All of our websites are live. All of our call centers are live. Beneficiaries can make a selection if they want to. But we're really not starting the major marketing activities until March 15th. So we have a little runway to make sure that everything is working correctly and working out any bugs. Then starting on March 15th, you will see North Carolina Medicaid is actually doing paid media. We are really encouraging beneficiaries to select a plan because we want them to have a choice and have a say in how their health care is delivered. We also will see marketing materials from the health plans themselves. They will be trying to encourage beneficiaries to choose them. And then we will also have marketing materials from the enrollment broker encouraging folks to make that selection. So between March 15th and May 15th, that is our open enrollment period. They can choose a health plan at that time. Nothing will change. They will just make a health plan selection. And we will send out reminders midway to really encourage them. For folks who don't make a selection, then we start the process on May 15th of auto enrollment that selects a health plan for beneficiaries for those who do not make a choice. So that will be, we have an algorithm that sort of is like a funnel, and it sorts them through like based on where they live, what health plans are available there, what health plans their primary care physician is already contracted with will be taken into account. Whether any other family members in your family have already selected a health plan, then we are trying to keep families together. And so it'll go through our algorithm and then assign beneficiaries to health plans. Then between May 15th and July 1st is really when we hope to do the transition of care activities. So that'll be sending information about prior authorizations for services to the health plan, claims history, so that the health plans will know more about the health of the beneficiaries that have either chosen them or been assigned to them. Scheduling for non-emergency medical transportation to appointments to make sure that that gets picked up on day one. So we have about a month and a half where we hope that that transition of care is lined up. And then on July 1st, we hope for a seamless transition of care and launch. And then between July 1st and September 29th, there's a 90-day period. We're calling it a choice period, where beneficiaries, if they don't like the health plan they're enrolled in, they can make a different choice. And then after that, they will be allowed to choose and change their health plan. After the choice period ends, they will be allowed to make that choice at their re-verification. When their eligibility is re-verified, they will have the option to change their health plan. So we have been involved in working with the counties. Myself and our Associate Director of Member Operations, Carolyn McClanahan, and her whole team meet regularly with the North Carolina Association of County DSS Directors. We also work closely with a smaller work group that is focused on Medicaid transformation. And we've come up with a couple of support strategies for our county DSSs that I wanted to share, make you all aware. We do have a county playbook that is a compilation of everything counties need to know for Medicaid managed care. We had this last time. We got some feedback from our work group, and we've sort of revamped it and reorganized it so that it's more user-friendly and updated it with all new information. This is available online, and we have sent this information out to the counties. We have provided virtual trainings with the enrollment broker so that they have information about managed care. We send weekly emails to our county DSSs. One thing that we have learned during our COVID-19 work at the department level is having 30-minute stand-ups with smaller groups of counties of 25 is a way to provide real-time information and receive feedback from counties about what's actually happening on the ground. And so we hope to start those during the open enrollment period so that we can hear how it's going. And then, of course, we have the eligibility and readiness support through our NC-FAST teams and our operational support teams. Nothing about what your county DSS is doing is going to change. They are still responsible for making Medicaid determination, but we do anticipate that because beneficiaries know to call the county DSS for questions about Medicaid, that there is probably going to be some questions that they may be able to answer and maybe see an uptick in the number of calls that they receive. So that's why we're trying to give them all the information that they need ahead of time. And I think I'll get to the next slide and talk about what the enrollment broker is doing. The enrollment broker is, so the county DSSs are not responsible for helping beneficiaries select a health plan, and we encourage them, we actually require that they do not do that, that it's through the enrollment broker. So the enrollment broker is also providing some supports. We have the virtual training I mentioned. We have an enrollment broker DSS liaison, and then each individual county, all 100 counties have been assigned a county liaison. So they have a county liaison that is assigned to their county, and then they have a point of escalation if there are other outstanding issues. And then for the day-to-day run-of-the-mill questions, there is a support line that they can call, and then there's outreach materials that have been sent to the county DSSs, posters and palm cards about Medicaid managed care. Next slide. So in addition to our county DSSs, we are working with the North Carolina Association of County Commissioners and PHPs. There's a monthly meeting to talk about issues that are affecting counties there. We also are working with our local health departments. We work with the North Carolina Association of Local Health Departments. We provide them updates on transformation and readiness and offering training and support for care management. Our local health departments will be providing care management for at-risk children and care management for high-risk pregnancies for the PHPs, and so they are directly impacted. And then for non-emergency medical transportation, this is transportation to and from medical appointments. We are working closely with the North Carolina Public Transit Association, the PHPs, and their transportation brokers to make sure that public transit is maintained as a service through Medicaid managed care. And so finally, all of this is happening on July 1st, and then we have about a year's transition, and then we will be launching our behavioral health IDD tailored plans on July 2022. These are plans that provide the same services that will be provided through the Medicaid managed care plans, but they will also have specific additional services for individuals with high behavioral health needs, intellectual and developmental disabilities, and traumatic brain injuries. So this will be a very tailored plan to meet those high touch needs. Only our 7 LME MCOs will be allowed to bid on our tailored plans, and we estimate 175 individuals will enroll. And so I think that is the end of my presentation. I covered a lot of ground. There's a lot of information. I am happy to answer any questions or address any concerns you may have.
So I'm looking at the commissioners. Are there any questions on the Medicaid transformation? I see Commissioner Carter.
Thank you. This is a really complicated topic, I think, and I thought you did a good job of providing a lot of information in a short period of time in a clear way. I'm glad that we'll have this presentation to go back to for a reference. I guess the question that I have is just thinking about how this might impact local county budgets. Do you see a way that this could have an impact on our local budget? Are there any things we should be more cognizant of as we adopt our budget this year, knowing that Medicaid transformation is underway?
So this is something that's come up in our work group with the county DSS directors, particularly around staffing, or staffing for non-emergency medical transportation, for example. We shared with the local county DSS directors the breakdown of transportation and who is moving to managed care. And we found that statewide, only about 15% of the folks that use your non-emergency medical transportation are moving to managed care. So we're still going to need significant county support for that non-emergency medical transportation at the local DSS level, because 85% of our caseload is going to be still outside of managed care and not coordinated through there. We don't anticipate any other significant staffing issues at the county DSS or at the local health departments. So I don't know that there's going to be significant impact, but it is something that we have talked about and tried to dig deeper into. And I am happy to share with you Durham County's breakdown on non-emergency medical transportation if you don't already have it. But I think that would be the only thing that I would raise up.
Okay, thank you. Appreciate that.
Mr. Burns?
Mine was really quick. I'm thankful that Heidi asked that, because I did wonder about any of the budget impacts. And now I actually have a follow-up to that. My first question was, on the initial slides, you said that 1.6 million individuals would be transitioning from 2.5. You probably did tell us what that 900,000 person gap was. I just missed it. So why is everybody not transforming over? Because again, public health is not my forte. There are others who probably know, but I don't know. And then also, if you, others on the call, because they've probably been through a presentation like this one before. And follow up maybe to Commissioner Carter's if you have time. I'm assuming that non-emergency transportation, getting people to appointments, i.e. dental, i.e. Okay, so you're nodding your head on that one. So then we'll just go back to the first one. What's like the 900,000 person gap there? Now,
yeah, so not everyone is moving to managed care. We do have a portion of our population that I mentioned will be moving to our tailored plans in July 2022. That's only about 175,000 of those individuals. Then we have a portion of our population that is in our our community alternatives program waiver programs. These are long-term services and supports. So we have our CAP-DA program for disabled adults, or CAP-C program for medically fragile children. Those individuals will also be carved out of managed care. And then we're carving out our dual populations. Those are people who are eligible for Medicare and Medicaid at the same time. We call them dually eligibles. We have legislation that requires us to move all of these populations into managed care within 5 years. So right now we are keeping them out of managed care, transitioning the largest portion of our population and the healthiest portion of our population, which are families with children and pregnant women, and really trying to build tailored plans that meet the needs of our most high needs individuals at a later date. So we're starting with the tailored plans, and then we will carve in individuals' long-term services and supports and our duals.
You mentioned that you're right. There are individuals who are on Medicare and Medicaid. I always like to think about them differently. Medicare for me is care for the elderly, and Medicaid, that's how I was always taught to look at them. But you do have a substantial number of young people that might have autoimmune deficiencies or might have cancer, and so if they have if there's an issue with a major organ, they're on Medicare as opposed to Medicaid. So you're saying that you're trying to, move that group. The other group I'm wondering about, is there any move to try to get some of our veterans that might be on Medicaid moved to TRICARE? Because I know that there was some work done at the General Assembly maybe about 2 years ago, and they saw that there was this veteran population. Once we got them to go to TRICARE, off of the VA, we saved $300,000 or $400,000 in Medicare. So is there any movement to try to get our veterans to come off of Medicare and move to TRICARE? And that's my last one this time.
We are not doing a dedicated push to do that. On Medicaid, you are allowed to have additional insurance. So there may be individuals that have TRICARE and are also on Medicaid. Not everyone, I believe, depending on a number of factors, is eligible for TRICARE, even though they may have military service. And so we do have folks on Medicaid that are not eligible for TRICARE, but we are not doing that at this time.
Thank you, Melanie.
You're welcome. Thank you.
Commissioner Jacobs.
Thank you, and thank you for the presentation. I guess one of the things that maybe we can bring in Ben is just to give us a little bit on the local level. We've talked about this a lot within the DSS board, and I know first of all the Taylor plans are going to be administered by Alliance, which Heidi probably knows about that, and I think also what is interesting is that a lot of our transitional age foster care youth are going to be on the Taylor plan. So kind of getting at what Commissioner Burns was also saying is that there will be youth who have really high needs and really need that extra attention. They will get that through the Taylor plans, which Alliance is going to be bidding on that. And then
we are actually going to have a separate foster care.
Oh, you're going to have separate
product.
Totally separate. Okay, great.
There may be overlap, but we are trying to build a statewide foster care plan because this population is super mobile.
Fantastic, because there was a lot of concerns about meeting their needs specifically. So that's great to hear. And Melanie, I wonder if you could speak a little bit about, I think for me, one of the things that's most exciting about this is merging the mental health and the behavioral health together, but also the Healthy Opportunities pilot. And you mentioned, for instance, transportation, but the fact that doctors or providers are going to be able to write prescriptions for things like healthy food or housing or transportation. So really looking at the social determinants of health. So if you could talk a little bit about that, and then Ben, just about what we're doing here locally with the town hall and how many folks we're looking at in Durham who are going to be moving into needing to pick a plan?
So there's actually a lot that we sort of lump together and talk about healthy opportunities. The first thing that I do want to say is we are requiring all of our health plans to do a care needs screening for all individuals that are enrolled with them that do check for social determinant needs. So whether they have issues with housing or healthcare or food or interpersonal violence is one of our key things. I think those are our 4 things that we are screening for. We've also developed a platform that is statewide called NC Care 360, which is an online resource that we're encouraging our health plans to use, but also local agencies use. And this is a platform where you can refer individuals to resources that may be able to address these needs: housing, food, interpersonal violence. And it is different than just sort of 211, for example, because it actually tracks the individuals. It makes sure there's a closed feedback loop. So it makes sure that individuals are actually going to get food, and you can see that that is actually happening. And that information is collected into their electronic health record, and the care manager will have that information available. And then finally, we're doing what you mentioned, the Healthy Opportunities pilots. These are pilots. I don't believe they've been awarded yet, so I probably can't say a whole lot about them. But we are sort of piloting in various areas of the state, working with local care management agencies and the health plans, bringing those 2 forces together to make sure that the individuals are connected to the resources that they need, in addition to NC Care 360. And those in those areas are where a provider can write a prescription for healthy food, or can write a prescription for counseling services for domestic violence, for example. And so those things will be happening in our pilot areas. I did also want to mention that each of our health plans have things called value-added services. And these are things that they're like the bells and whistles, the things that they're going to try to use to get individuals to choose their health plan. And so they're offering things like gym memberships and transportation, not only to the doctor, but just general transportation vouchers. They're offering car seats to babies, things like that, classes, Boys and Girls Club participation, those kind of bells and whistles that they will use in their marketing materials, but also actually are of value to our beneficiaries, and will address some of these needs as well. So I went on a little long, I'm sorry, but I hope that answered your question.
Chair Howerton.
Thank you. At some point, I just want to let Ben to give a local perspective too, at some point. Thank you.
Also with Chair Howerton, and then to the extent we have time, if Ben can give us something short.
Thank you, Ms. Bush, for your presentation. One of the things I'd like my board to know is the North Carolina Association of Counties have been doing these presentations for quite some time. Mr. Richards have been presenting it and talking about the managed care transformation, both the standard plan and the tailored plan. And if you go on the NCACC website, there is a lot of information that you can read through there. If you need another presentation, Kevin Leonard can always help you out with that as well. It is a very complicated, very heavy conversation that I think when Mr. Richards came to the association, he probably spent at least an hour, hour and a half with commissioners to go over this and questions to get answered. So just to let you know that Ms. Bush is what she's trying to do this morning is almost impossible to go through all of the information that that helps you to understand what this is all about and what it does. So just to let you know, And I thank you for trying, but this is not an easy conversation that can handle in a few minutes.
Very good, very good. I believe there was a request for a few remarks from Ben Rose. Going to give us some highlights as Vice Chair Jacobs requested.
Sure. Hopefully you can hear me. Good morning, everybody. Thank you, Melanie. I hear a lot from Melanie lately. She's on about every monthly call with the Directors Association, I believe. So we're very excited about Medicaid transformation and really have been supporting this project from day one. It's really going to change, I think, how Medicaid services are delivered for the betterment of our people. One resource too I would throw out there is North Carolina MedicaidPlans.gov. That's the actual website. And you can really learn about the plans there and just see, because you really just have to think about this now as our Medicaid beneficiaries are getting private health insurance kind of like we have. They're going to have their own card and they're going to have a slew of benefits. And it's and there's going to be a lot of preventative health and preventative care, which is all things that we've been asking for and wanting and we are very excited as well too, as Melanie mentioned, and I have shared it with the board. Wendy, you may have forgotten, but that foster care is going to be a specialized program itself. That is something that we have definitely advocated for as a county Department of Social Services. That being said, from a local perspective, we have over 72,000 individuals that receive Medicaid in Durham County. That's a lot of people. Most of them will be transitioning to the managed care plan. So therefore, our role really has been, one thing that the DSS is not going to do is, we're not in the business of promoting PHPs. We're not in the business of advising Medicaid beneficiaries of what plan to pick. That's why we have the enrollment broker. Now, we do partner with the PHPs and we partner with the enrollment broker, and that's something we've been doing pretty much since the beginning. We were actually one of the first counties to have, when this was initially rolling out before the budget issues, we actually had a town hall in conference room A, B, and C with the PHPs present, that beneficiaries could come and meet with them and learn about their plans. We're going to probably be doing something very similar to that, however, probably virtual this go around, obviously. We are meeting with the PHPs. Both the DSS board is meeting with the PHPs in March, and then we as an internal leadership group in DSS has a meeting with the PHPs and the enrollment broker. So we're going to be planning for probably late March or early April to do some outreach efforts. And that's what really we see our goal is. We want to make sure the Medicaid beneficiaries learn about this and understand it and help get them to the right people to make decisions. That's the biggest role for the DSS. We do anticipate a lot of phone calls. Melanie kind of alluded to that. I think that's going to be some of the biggest impact we have because we are the comfort zone for our Medicaid beneficiaries. The non-emergency medical transportation, I think, is another aspect to it. I was hoping to free up a little staff space there to reallocate some folks, but we do see that we're going to probably be in that business for a little longer, and that's fine. That's okay. But we are very excited as a county DSS about this. I think Dr. Cohen has really set forth a bold vision, and Melanie and all the staff in Raleigh are just really carrying this out. And this is a state project and a state effort. And we are just simply supporting it on this end. We really, as Melanie alluded to, nothing really changes in terms of what we do day to day. We're about determining eligibility, trying to do that accurately and timely. As you remember, over the past year, we had challenges with that, but we're at a better place now, thanks to Rhonda, Catherine, Crystal, and their staff. But we are really here to try to support and coordinate, and that's why we're having these partnership meetings. And that's going to be our role over the next 3 months because one thing I don't think Melanie pointed out that has been alluded to with some of the presentations we've had is that a lot of beneficiaries initially do not enroll, so they get auto-enrolled. And that seems to be kind of the trend when these plans roll out across the country. So we want to do all we can to have our beneficiaries, and they're going to get bombarded. They're going to get stuff in the mail. They're going to get emails. They're going to get all kind of information, but it still can be confusing. So that's why we have the enrollment broker. And our goal is going to really try to be a pipeline to get our folks to the enrollment brokers to help them navigate. So other than that, Melanie did a great job, as always. Thank you, Melanie.
Thank you. And I do want to say you're absolutely right that most people don't make a choice in other states and other markets. And that's why this go around, we are doing paid media directly from the department. We don't usually do that. We don't usually have money for that, but we are trying to make sure that the beneficiaries are aware of their choices, and we want to encourage them to make that choice for themselves.
Yes, thank you.
Very good, very good. Are we concluded on the Medicaid transformation discussion?
Martha, I
we
just want
also-
to jump in one thing, which is that Duke has applied to be one of the Healthy Choice pilots. So let's keep our fingers crossed that we're going to get to do that.
Very
Good
good.
morning. And we also have EMS David on the call. I didn't know if he wanted to just provide a perspective regarding EMS.
I certainly can. Good morning, commissioners, and I hope everybody's doing well today. There is a parallel process that's going on for the Office of Emergency Services, specifically within business services and EMS, to support the transformation effort from our side as well as a 911 emergency ambulance provider. This is also impacting us. We have been engaging with the Big Five communities or counties within North Carolina and our billing vendor as well to ensure that the contracts really meet our needs and protect the county as well. So that work continues, and we're anticipating all contracts coming to you sometime late this spring for your review and approval. But that's pretty much what we're doing.
Very good. Thank you so much. So, are we ready to move on to our next agenda topic?
All right, I'll just say thank you all for having me. I'm happy to answer any questions you may have. You can shoot me an email later or look on our website. There's tons of information out there. All right, thank you all. Have a great day.
Bye-bye now. So right now we are ready to get into our policy review. When we left yesterday, we had commissioners stating their most important priority item for the budget. And then the commissioners had a homework assignment. And I am amazed and in awe how rigorous and abundant the responses were. We had asked commissioners to come up with a list of 2 to 3 items, and we got a list of 52, if I count right. Don't hold me on counting. That's why we have the budget folks to run spreadsheets and pivot tables and the like. Today, we want to bring things into greater focus. We specifically want to go into some of the policy items that you brought up. Yesterday evening, the staff went through the submissions and added to the list of policy items. And Claudia Hager, I thought, did a very nice job of trying to pull that up a bit to show the high-level policy items. So I'm going to ask for the next slide. We could have the next slide.
Yeah, hold on just a second.
Oh, no worries. I know you're doing 1,000 things at once.
Hold on, we're getting there. Yeah, there we go. Can you see that? There we go.
That's not the slide deck I was expecting.
Okay, so Martha, we had moved. Okay.
Oh, okay.
Yeah, because those were the staff items, and then we're going to do this, but we'll go back to that next. Okay, all right. Good morning, commissioners. Thank you for all of your efforts yesterday. Although Martha gave me the credit, the budget team did the yeoman's job of showing and consolidating the information. There were several major policy items that came out of the list from the various commissioners. Some were captured yesterday, and some during the conversation, and some we were able to compile based on your list. And so I'll go through them kind of quickly. And then Martha, you can help us in discussing next steps with the list. The first one being the property tax relief and looking at how do we use social services and the as a potential place to help us implement that effort. There was an identification for us to talk about our transit plan and efforts post light rail, and also looking at the properties that were purchased during that time period and how do we proceed with those. Some reference the need to talk about the budget framework, and also looking at the implications of reduction scenarios as well as the hiring freeze for the current year and in the development for 2022. The number 4 was one that came from both the manager and some of the commissioners, just some understanding about tax increase necessities and if there's a willingness to consider them. Number 5, there was conversations about this in a couple of different ways, but it did show up as an area to enhance community outreach for agencies applying for funding opportunities to promote equitable access to government funds. Number 6, increase data to help justify or guide funding decisions. Number 7, evaluate all decisions that we do at Durham County through a racial equity lens. Number 8, housing crisis and an estimate for at-risk households for rental assistance and eviction crisis. There was one for the education referendum bond to address DPS capital project needs. And number 10 is looking at bolstering Durham Tech support to enhance the infrastructure needed to train residents for new jobs coming to the county. And number 11, enhance community discussions from groups to step up Durham to clarify barriers and opportunities for individuals seeking employment. And those were the major policy items that were identified. And one of the steps that we will do after this meeting, and you can get from us, is map how they align with the strategic plan. If you may recall, there was a sheet or summary table that we showed how the different priorities aligned with the strategic plan, and we'll do that step. The genies did not show up last night for that step, so we couldn't summarize it in time. Okay, now Martha, would you like for us to, we'll go to that next slide as far as follow-up deliverables. We had quite a full day and quite a list generated. And I will tell you, the budget team on some of these worked, and we were just trying to think through what can we do today, because it's just our nature to try to respond as fast as possible. But most of this we're going to have to come back on. One was benchmarking counties' expenditure costs, similar to the side on the general fund breakdown. Number 2, there's a request for us to clarify the administrative costs for Mecklenburg County's tax deferral program. There was, on number 3, this is aligned with number 2, some discussion was made about following up regarding the consolidated difference with Mecklenburg's structure as it relates to tax relief. Number 4, General Services is going to share some information about the living wage for janitorial services, and this is related to our contractors. Number 5, update on Bull City United and the COVID impact. Number 6, data on real unemployment rate, not just the standard measure. 7 is related also to unemployment rate information by sectors. Number 8, updated food security data broken down in more granular areas such as by seniors, et cetera. More information on the largest taxpayer and that kind of demographic, those kinds of comparative information. Number 10, per pupil report by county. This is related to Durham Public, to our schools comparisons. 11 show disaggregated unemployment data by census tract, or is now narrowed down as possible. And number 12, and some of these are some duplicates that we saw as policy items. So you will see some overlap. Number 12 is related to the vacant undeveloped land in the county as a whole. And some follow-up of the study that was done a few years by real estate as well. Number 13, how trends towards moving out of downtown Durham affect transit planning. Number 14, clarify which properties were purchased for light rail and what properties can be repurposed. Number 15, clarify the Durham County policy on land banking for future needs such as affordable housing. Number 7, again, this is a deliverable, but also a policy issue. Across the board cuts, how will they impact the organization? Some discussions about the hiring freeze, and then 18, education around accessing funds from city, county related to nonprofits. And so there are some overlaps between the list, but from the policy list that was developed the day before, coupled with the list of items that we captured throughout the day, we have a good picture from what we believe of items that we need to follow up on.
Yes, indeed, there are certainly a number of issues that the staff has promised to follow up on. Going back to the major policy issues, this is quite a list. Some of these things I suspect will come up during budget. Some of these things, you may want to tackle as part of the budget calendar. Were there any comments from board members about the major policy issues that we raised, or ones that you want to speak to? I see Commissioner Jacobs and Commissioner Alam. We just want a few minutes of any reflections on these policy issues, and then I suspect the manager may have some comments he wants to add in. So Vice Chair Jacobs.
Well, first, I just want to thank Claudia and Keith and everyone who worked together last night to try to synthesize everything and come up with this list. I can't imagine how challenging that was. Thank you. I guess one of my questions is just how we're going to go about discussing these as a board. And it seems like some of these are more time sensitive and have, things that we should talk about now versus some things are more kind of long-term. So just that's my concern, is picking out the ones that maybe are, that are more timely that we should talk about now because they even impact decisions that we're making the rest of the fiscal year, like things like related to the, current hiring freeze and things like that. So maybe how can we pick out some of the more broad things as the next step? So just, yeah.
And one comment that I'll offer for the agenda that we've put together, we're going to, in a few minutes, go to not only the budget guiding principles, but the budget development framework. And I think really try to use those two documents as our way of seeing if there are some right now, right here, updates that we need to make so that staff understands your marching orders for budget investment. So I think that that's the approach that we'll make, to get those things in order so that we start off the budget process with a clear perspective. Commissioner Lam, I see that you had a question or a reflection on the quite ample list of policy issues.
Yeah, I just had two questions. One is more procedural and one is related to the policy issues. So being my first budget cycle, I just wanted clarification. I know, thank you so much, Claudia and Keith and staff for collecting. I was worried when I sent my list of 10, I was like, I'm breaking the rules, but I'm glad I wasn't alone with the rest of the commissioners. There was like two issues that, one that I had included in my email and one that was brought up yesterday that I didn't see on this list. So I was just wondering, is it going to be something that we discuss later on in the process? Okay.
Yes, there, and I should have clarified, there's a third list.
Oh, okay.
that shows, and Keith or David can help frame it best, but that is a list from a funding perspective, and I probably should have done a different job with that. So there, in explaining the two, I think it's probably sleep deprivation. So there, we asked the board to give us two sets of lists. One, major policy issues. And then two, sort of from a funding priority perspective, what would you like for us to invest in the next budget cycle? And so some you will see on both lists from a policy perspective, as well as the budget investment. And so we'll get to that list, but what I also did was show the list of follow-up items. And so we'll get to answer your question, Commissioner Jacob, and the rest of the board as far as how do we put our arms around all of this, because it's a lot of areas of focus. And what we've tried to communicate is that we will use our board meetings as well as our work sessions to come back to the board with brief policy conversations. And we've somewhat been doing that this fiscal year with our updates on sort of where we are with spending. Is this a standard process? So for an example, we've already stated, or we plan to come back to the board in April to talk about the capital improvement plan and that planning process. And so we will remind the board where we are with our planning process, what's currently outlined, and what would be steps if consideration moves forward for a referendum. So that would be an example. So for our next step, we can take the list and come back to the board by next week and give some tentative dates of when we can follow up. So for an example, the number one, I gave one about the capital improvement plan, but number one on property tax relief, I would see that as an earliest in April discussion, as we have to do research and follow up with Mecklenburg and cost estimates. So we can get to you by next week, a draft list of when we can follow up for some of these items. or we can give you some responses for some of the others, such as the implications of the hiring freeze and reduction scenarios. That is one. We can talk from a policy perspective of what those reduction scenarios meant. And I can quickly share, last year this time when we were faced with so many unknowns, many counties took different approaches on how they were going to manage their budgets. Some counties, even such as Wade County, they asked their departments to submit budget reduction scenarios. I think as high as, I can't remember the number, but it was a pretty high number. We took a different approach and said, hey, let's freeze positions and see how we move through the fiscal year. But in the fall, let's plan by making some budget reduction scenarios in a time frame that is not as pressured. And we'll manage our budget that way by sort of controlling how much we spend based on what that revenue picture looks like. And at mid-year, we'll adjust accordingly. That would give departments time to make some decisions a little bit more thoughtful if permanent reductions had to occur. So this fall, based on our plan this time of the year, we asked departments to start thinking about the what if scenarios. What if when December came or January came, the revenue picture was bleak. And again, last year, this time, it was a bleak picture. And even in June and in July, we weren't sure what we were gonna look like. So in the fall, I believe it was around September, we asked departments to start looking at if you did have to make reductions, to prepare scenarios so that if in December, so if during the budget development process, they came to fruition, it would not be in a hurried time because we wanted it to be more thoughtful. So those cut scenarios, although they did them based on our current revenue picture, we don't foresee that we're going to need to implement them. However, we haven't finished our budget development process. But if we do have to make some adjustments, the departments have already started thinking about those areas. So I wanted to give some context around what those cuts are, what that process was. But again, based on what we're looking at right now, we don't see the more drastic upper end. I think we asked for scenarios up to, was it 7%, Keith?
Yes, ma'am. We had 3, 5, and 7% reduction.
Yes, 3, 5, and 7% reductions. And for those who have been in environments, this is a standard planning process that happens. We don't, thank goodness, foresee needing to do that. We also ask departments to evaluate, well, what's mandated by general statutes, what's a local requirement, and to prioritize sort of looking at level of service and how do we continue level of service for those priority areas. And so again, we can come to the board at the work session to talk about that process even further. But at this juncture, it's not something from a cut perspective we're asking departments to do. But we've not finished the budget cycle. So we'll have to work through that. And so Martha, I think from this list, I guess we can gauge with the board, does that process sound appropriate for how we proceed with next steps?
Be happy to have some board members weigh in. I think no comment would be concurrence, maybe some head nodding. If there are any suggestions about alterations or other things that should be considered, certainly would welcome those. Vice Chair Jacobs?
Well, one thing I don't see on here that I brought up was just about, and maybe it's under one of these other categories, but it just was around, I guess, related to the property tax increase discussion, but was related to fund balance. And
That's one of the
just,
other.
yeah, is that related?
That's on the other list. We have another.
Oh, okay. Okay.
That's the one with 50 some.
Oh, okay. Okay. Got it.
David's gonna show that screen, and we'll see that longer list.
Okay. Okay. All right. Thank you. And so we're gonna now look at the framework so we can talk about some of the more imminent issues. Yeah.
Yeah, and I did see,
Yeah.
I believe, a
Okay.
hand up from Commissioner Carter. I may have misread that.
I was just going to say, I think what Claudia said is absolutely right. You know, we can't expect to discuss all these today. And I liked her idea of having staff look over them and figure out where it fits into a work session for the future. And I was just going to also ask if maybe one of the, I bet, you know, I'm guessing you all probably tried to look at all of our 52 suggested priorities to see if there were any, was there much overlap, or, you know, did some of us name the same ones multiple times, or at least similar ones that we might have put the sticky dot on if we'd been together, you know, something like that, that might help us, I don't know, focus in.
Sure.
Yes, and we can take a look at those. There's a, you know, detailed spreadsheet that we might look at more toward the 11 o'clock timeframe, or when we're looking at board priorities, just you know, quickly walk you through what some of those things were. Were there any other comments on how to address these policy issues? Again, as I'm looking at the list, you know, today we're certainly going to be discussing the budget development framework, item 3. We are certainly hoping to begin a conversation about item 4, tax increase, if that is necessary. Certainly one of the options that you need to consider. So those two things, I know for sure discussions will begin on today.
Okay.
Any other thoughts from commissioners before we move to, I think the next thing up would be to go over the budget guiding principles and then the budget development framework.
And Martha, right before we got to that, for those two, there were a few quick slides that we were going to update the board on from yesterday as far as follow-up. And
okay,
we'll do that. And Keith,
you want to do that now?
Yes, please, if you don't mind.
Keith,
if you could just go to slide 9. Well, you can show this list. This is a reminder of the list that we had for expenditure drivers of the budget. We'll not go through them. In the next slide, the reminder that if you forward, we have right now seeing a need of 24 million with a gap of about 20 with revenues at $5 million. 1 cent on the property tax is $4.4 million, and that'll be shown on the next slide. And Keith and David can walk through this next one, which is a view of the impact.
Claudia, this was a request by Commissioner, I'm sorry, I forget which one asked for it.
Commissioner Howerton.
Howerton, yes, ma'am, thank you. Requested to see what a property tax rate increase would be on different valuations of houses. So for a $100,000 house, the current property tax rate of 71.22 cents would be a tax bill of $712. An additional 1 cent on $100,000 is $10. An additional 2 cents is $20. I won't go through every one, but for a $250,000 house, a 1 cent tax rate increase is $25, on top of a $1,781 county tax bill. Let's not forget, if the vast majority of Durham County citizens are also city residents, and there is also a city tax rate on top of the county tax rate. It is that combined rate that most taxpayers in the county experience. So while this is only looking at a tax rate increase for the county, a city resident would also experience any potential tax rate increase from the city as well. Just wanted to note that. Another piece of information. Yes.
So Keith,
Yes,
are you
ma'am.
saying that would mean that if it's $25, it would double, it would be $50?
It would be if the city raised the tax rate a cent. For example, we don't know, that's not under our control, obviously, but yes, ma'am. If the house was valued at $250,000 and the county raised the tax rate 1 cent and the city raised the tax rate 1 cent, that would be a $50 increase for said resident.
Thank you.
Yes, ma'am.
I just want to thank Brenda for asking for this. I think this is a fantastic table. It makes me excited to have it. Like, I'm going to print this out and like put it on my wall somewhere for reference. You know, when we think about what will the real impact on a taxpayer be, you know, in these various scenarios. Great question, Brenda, and thank you guys for pulling together such a wonderful table.
Well, you think about the people that are just barely able to, or barely making it right now. And $25, $50 means something to them. Means whether or not they buy groceries or not, or it means that whether or not they buy their medicine or not. So it's just something we have to consider.
Any other questions? All right, there was another question. I think, again, I'm sorry, I can't remember which commissioner asked it, but we tried to, as Claudia noted, tried to answer a few of the quick questions that we could. There was a question about the percentage of residential valuation in the county versus commercial valuation. And Durham County has progressively been moving more and more residential. In 2001, 51% of the total county valuation was residential and 48% was commercial. 2010, you see an increase in residential to 53.7% and a reduction in commercial from 48 down to 46. Same trend continues through 2020. We're up to 55% and 44%. I personally can't read a lot into that. I can say that we've had population growth in the county. I don't know that RTP is once what it was in terms of how we valued commercial property. We are, if I were to sum it up personally, I would say we're more brain centered than we are manufacturing centered. And the valuation is on property, and office buildings are not the same as manufacturing buildings. I think we had, and so the change in RTP and the change in what services are and are provided are different 20 years in the future from 2000. How do you tax someone like Google? Do you understand the difference between that versus someone building a car or textiles or whatever the choice is? And on top of that, we've had a lot of people moving into Durham County. So this is not surprising that you would see a trend towards more residential and a trend towards less commercial.
One other quick point about this slide. When we talk to rating agencies, they want to basically know what is the mix between commercial and residential over a period of time. And although there has been movement, it's not been material movement. And the mix is, we're not too heavily relying on commercial compared to residential when you look at our peers. And some of our peers, their residential rate may be closer to 70%. And that's a much larger pressure on their tax base. I don't have those numbers right in front of me, but that is also something for us to keep in perspective. And we'll send that slide to you that will also show comparisons to our peers that would give additional perspective. But as Keith shared, the numbers are trending down. The great thing, if you look at per decade and if you saw each individual year, is gradual, but it is something for us to think about as the population changes and the mix of business types change.
Thank you, Claudia. That is correct. Of some of the counties that Dwayne compared against, the amount of residential in a number of those counties, particularly ones like Buncombe and New Hanover County, had a huge amount of residential versus commercial. We have a nice balance. It's a relative situation. Next, I'm going to move to the next slide.
Keith, this is Wendy. Yes. I just had a quick comment. First of all, this is great also. Thank you. And I maybe Jay or Andy could comment, but I think what you said seems to ring true, that when we're looking at our economic incentives now, it looks like we've got less and less real property value that's coming before us, like you were saying. But I think it would be great to, if you could do some benchmarking, which you just said, to see what our split is like compared to who we benchmark ourselves with. That would be great. Thank you.
Yes, and we can definitely share that information. We look great compared to many of our peers, and so the challenge for communities across the country is how do you keep that right balance when people can work anywhere in the world. And so the great thing is, although there's been some movement, we've retained well.
Right. And Claudia, it feeds into I think the rationale about why we do the incentive projects. Absolutely. Because it helps to take the pressure off of our residents and off of our homeowners. It redistributes the burden to commercial and industrial. So
yes, and the only reason we did not put the peer benchmark information up there was that we felt we may get too deep in the weeds, because all of David, Keith, and I are we review so many percent changes in between year to year, et cetera. We didn't want to spend too much time on it, but we will get that to the board, and that definitely can be a policy discussion that we add to our list of things.
I believe I see Jay Gibson raising his hand. That may be an artifact of Zoom.
Good morning. Good morning, everyone. It's an artifact of an old man, but it's not an artifact of Zoom. Just one quick point, commissioners. From a planning perspective, an ideal split often is somewhere in the 60-40, 70-30 range. When you're looking, if you were doing your land use maps, you're trying to plan your community, your county, a lot of times people will target something in that range, and a 60-40 often is considered very ideal. Back to Commissioner Jacobs' point of, you have a good mix of uses and you have enough industrial commercial base to properly support the services you want. So I just offer that as a very quick point of context that I believe Claudia gave some too. We actually have something that would be the envy of a great many places around. So thank you.
Very good. Thank you.
All right. The next slide, went too far. We wanted to bring up one more time a reference to department performance measurement and the Managing for Results program that the manager has championed since he's been here. Wanted to remind commissioners that there is data out there for strategic plan, community indicators, and department performance measures on the transparency portal. And you can, if you have a copy of this, you should have a link in that PDF document that's part of your agenda. If not, you can write down real quick. It's pretty simple, www.data-dconc.org. And at that site, you can delve into this data. It is updated through Q1. and will be updated again through Q2 by the end of this month, if I'm not mistaken. Bethany Shoemaker in our office does a fantastic job working with departments in our office to keep all of this information up to date and to continue to refine it and then make it as useful as possible. Are there any questions about this? And I think this was in reference to a Commissioner Jacobs question yesterday. So we just wanted.
There's also a button on the main website that's been there since last year. That is, you can also click it from the landing page of the Durham County landing page. So that's the other one. But we'll also have this as a conversation in April, and beyond the data, have some departments share how they're actually using the information. It's one thing to have the data, but it's another, well, what are you doing with it? And from a department perspective, the high level measures that may be in our budget document or the strategic plan measures, those are public facing, but the ones that they're using that are drilled down at the department level are the ones that are moving the needle in a way that you may not see and that are facilitating process improvements and change. So we want to tell those stories. We don't slow down a lot to share that. So in April, we can come back to the board and give some of those examples.
And I think that, Claudia, ends the update. I see Jay, do you still have your hand raised or is that left over?
Is that another artifact?
Might be. I think that ends our summation. And
that was an artifact.
We can move to the policy information, Claudia, the budget policy information, if you're ready to do that.
Yes, that's great.
Let's get through a few slides here. So, and I'll leave it to you, Claudia, to run this as you see fit. This is the Durham operating principles, guiding principles.
Yes.
And Claudia, would you mind if I just said one thing as context?
Sure, absolutely.
You know, as an outsider or someone who looks at a lot of county budget processes, I see these as two different but related items. The budget guiding principles, the ones that you have before you, are, I think, very common, excellent principles of sound financial management for the most part. I'm guessing, you know, Claudia or staff will, you know, go over these. There may be a couple of things that you might want to, you know, look at in more detail. I think the real meat will be on the second item, which is the budget guiding, you know, the framework, which, you know, communicates a lot of the current assumptions about things. So I'll let Claudia dive in, but just thinking as far as how we'll use our time, it'll be more on the budget framework.
Okay. Several years ago, the board adopted guiding principles and to help us develop the framework for the budget. And as Martha shares, these are guidelines that are a combination of what's statutorily there, but also recognizing our financial policies and other efforts that are in the county that help us maintain our financial standing. A couple of years ago, we did spend some time and tweaked some of them. We shared this with the board for them to give feedback if there's something that needs to be changed. The link to this information is also in Legistar because it is, I know, quite tiny to see on the screen. So with that, I would ask if there are any of the principles that we would need to change, or if the board is in agreement overall that these guiding principles are fine.
Can you turn off the music?
Actually, we may have enjoyed the music.
Easier than looking at this.
I know it certainly is. I know
Oh
there
my
was
God, I'm so
sent out
sorry.
to
I
this.
didn't know that I was not on mute. So-
No worries. No worries. I don't know whether,
I'm fine with these principles, Claudia.
Okay.
I don't know if Commissioner Jacobs' hand is up, but I'm fine with these.
Okay.
Yeah, I as well.
I see Commissioner Carter nodding.
Yeah.
Netta's looking for, something to eat.
and
I'm giving my thumbs up, Commissioner Burns.
Where's your other hand?
Wait.
I just had a comment that I thought it was really interesting to read over these because I think actually there's some alignment with some of the things, the list that you just showed us, Claudia.
Yes.
Like, I'll just give you an example. Number 15, where it says sound decision-making based on performance metrics where possible.
Yes.
That, so I actually would like, when we have time at other meetings, to go back and really dig into these, because I think that a lot of concerns that we've seen or that were already on the list, they actually already relate to what's on here. I don't think we have time to really dig into this now. But I think these are really important. Anyway, so it just struck me when I read them again, like, wow, maybe we just need to kind of reinvigorate them or have a more robust discussion about, are we actually doing some of these things, or how could we do them better?
So with that, we can plan to when we come back in April, we'll put this on the agenda for the board to just revisit again or not. But again, I'm glad it's in the forefront of everyone. And so we can move on to the next one, which is talking about the actual framework. And we have this slide here, but the next slide this was in page 6 of that budget framework document. We just want to remind you where it came from.
Claudia, just
Yes.
quickly, when you bring the operating budget principles back, I would recommend that we break them up, that we don't try and have a conversation with all of them at one time, that we do a portion of them at maybe one work session, and maybe some at a different work session.
Okay, well, we will take that approach. Typically, when we, for instance, when we have board discussions about either our finance policy, which is about 22 pages.
Yeah.
We sometimes will break up the conversation. So my thoughts are we get some board feedback before the April meeting. And so that when we have the April discussion, we can know where there may be some areas of concerns or tweaking. So we'll design a process for that.
Okay, thanks.
All right. Yes, Commissioner Carter.
One idea I'd like to lob up to see what you all think is, we've talked a lot about how we want to think about the racial equity impact on every policy decision. Would that make sense then to include, either in the framework, either this slide or our guiding principles, that we'll develop the budget with a racial equity framework, or we'll develop the budget by way of making a racial equity impact analysis, in our funding decisions, or something, just something that I know I feel like covers all of our desires around that.
We can have that as an addition.
almost like it says, evaluate the return on the investment, evaluate the return on the advancement of racial equity, or, I don't know, whatever people think. I just wondered about that. Never thought of it before, including it like that in one of these documents.
We will come back with some examples, also looking at how other communities have framed it. There are some communities that are further along with integrating racial equity in their budget development process. And so we'll look at that language as well as process as part of the policy conversation, and then as well how we integrate it on the list. Thank you.
I see Commissioner Alam.
Yeah, this was a question I was going to ask earlier, but Claudia, you've kind of explained it. I was just thinking maybe for like community members who are also watching or may watch this recording later, could you and your team just give like a brief overview of like how the budget process works? So we've had this budget retreat now. You're going to present to us at work sessions and regular sessions. And then when do we come back together so they can understand like how we actually come to this final budget?
Fantastic. That's a great comment. Keith, by chance, well, I was going to say if we pulled up the slide that showed the timeline, but Keith and I will tag team explaining the process. In the winter, around December, November timeframe, departments are given guidance on the development process. And this year it started with them revisiting their base operations and looking at how did they manage going forward for the next fiscal year, if and in fact there was the need for some budget reductions. So there's always that first look of base budget review. Those conversations kick off with departments in the winter around December. January, we have additional department discussions, and then in February, it is the budget retreat with the Board of Commissioners. From there, and Keith has put it up because he's just a magician over there. From there, we have the annual budget retreat. The departments, their submissions are due to the budget office February the 12th. And so when you saw the list that Keith put together, I mean, we showed this morning the slide with the needs that are pressing or priorities that or strategies departments desire to move forward. They are a result of those departmental requests. The Board of Commissioners retreat, you see that part. And then there are the internal budget meetings between the manager and general manager. The Durham Public Schools, they submit their budget to us, and that's not one we have on the list. There is a due date within our agreement that they're supposed to also submit their information to us as well as the external entities. The goal between the February budget retreat and May 10th is for us to have policy conversations with the board, additional follow-ups, but we're trying to make sure we get that $20-some million gap closed with a recommended budget to the board by May 10th. And then from there, we'll have budget work sessions and with the goal of having the budget adopted in June. So that's the framework, the schedule. We will, I'm sure, tweak some things. In this COVID environment, we're talking about our budget a little bit more than we normally do. So you will have the benefit of us having more targeted policy discussions as we work towards presenting the budget to the board in May. And so the only other point I will add, well, I can't think of anything. Keith, is there anything I missed, because he normally sort of walks through this?
No, I think a quick summary would be up until the manager's recommended budget, it's largely an internal management oriented process based off of experience and deep knowledge of what the county's needs are internally to develop the manager's recommended budget. And then that budget gets proposed to commissioners. I will note what Claude, we have on the website already, and we've already worked with our PIO office to, as much as we can, to notify citizens of an available email address from where citizens can provide comments about the budgeting process or needs. And we usually collate that information and send it out to commissioners once a week, once those things start coming in on a regular basis. And I know I had asked David to try to slap up a slide for commissioners and anyone watching with that link, but I know it's somewhere on the budget website, pretty right up front. I just don't have access to it right at this moment as trying to run this presentation. But I did want to emphasize any citizens that have any ideas, any comments they want to convey about the budget process or budget needs for the county or particular groups of people, feel free to go to the budget department on the website, on the county's website, and log in that information and request, and we will pass that along to commissioners. Otherwise, Claudia, you did a great job. Thank you.
Oh, thank you.
Yeah, thank you. That was great.
Mr. Lum,
Vice Chair Jacobs.
Thank you, Keith and Clay. I think what would be good related to Commissioner Lom's request is to add, if we're going to have a calendar, when the budget public hearings are, because there are 2 dates in our calendar that are kind of the official public hearing where the public can officially also make comment or submit comments. So if we could add those to the calendar too, that would, I think that, and we can help promote those dates. And also to note that the schools, they also have to submit their budget to us, I think by, is it March 1st, or I don't know the exact date, but obviously that's the biggest driver in our budget, right? Outside of our personnel.
I think they try to get it in, the maximum date is March the 15th, but we have worked with DPS to request that information significantly earlier. March 15th is really late in the process to get such a huge request. And David has done a great job of slapping up a slide real quick to show you the budget link, commissioners, that any citizen can be directed to provide feedback on the 21-22 Durham County budget. So that information is there. Maybe we'll talk with PIO, or we'll talk with the PIO office again to make sure they send it out or put it on a splash page for our website. And Commissioner Carter, you're absolutely right. There are open dates for public to speak, and we will put those dates on our slides. And in fact, we may show you briefly at some point during the rest of this conversation. I'm sure I have budget analyst and David working feverishly behind the scenes to get that information. But those are reasonable dates to put up.
And I see Chair Howerton.
This may not be the time for this conversation, but I think it's one that we need to have at some point to find out what is it that IS&T needs for our community to get back online, to be able to communicate to us that, I get asked constantly in the community that they cannot communicate to us. And we need to, whatever we need to do, if we need to add more resources in the budget, whatever we need to do to ensure that the community is a part of our process, it's just not happening right now. And they can you open up this portal you're talking about right now, Keith, but it still doesn't allow the community, because they can't come to our meetings. And right now they're not having an opportunity to communicate to the commissioners. And we need to fix that.
Commissioner Howerton, we historically, I know this past year was different. if you may recall, we typically would go to the PAC meetings and have conversations there. And we also would attend a few others. Again, this year, we can definitely look at ways of making sure we are on calendars for some of the groups that we've historically been on for.
So Claudia, that's not what I'm referring to. I'm for where the city, citizens can call in and have a conversation with the elected officials. We don't have we're not set up so that the community can weigh in. Like on our work session, that 30-minute period where citizens could call in and weigh in, they cannot do that. Is what I'm saying is, what is it that IT need in our budget to make that happen? Is what I'm asking.
Yeah, let me suggest that may be one of those items that goes on follow-up.
Okay. Yeah. We can definitely do that as a follow-up.
Absolutely. So does that take us back to the budget framework?
We can go back to it.
So, Claudia? So on the budget framework, again, this was at a certain point in time staff's best understanding of their marching orders. The first item deals with return on investment. And I just want to point out, when we're talking about budgets, there's a lot of money in what we call the base budget, typically. And so that when you're getting budget requests, you should know that staff is reviewing those very carefully and rigorously to try to get efficiencies and look at return on investment. So even your guidance that you're giving staff is something that they use as they're scrubbing the base budgets and looking at department budget submissions. The second item is an understanding to limit property tax increase as a solution versus using process improvement or strategic alignment of existing funding. That's one that we hope to have a discussion of today in terms of the appetite or any appetite or willingness to consider tax increase if it's necessary. So we do want to look at that one. The draft revenue assumptions, those have been covered in some of the introductory materials yesterday. Staff and economists give you the picture of what we're looking at as far as the available money that you have. Balancing the budget is a matter of looking at the different revenue sources, and staff has to make assumptions on them. The draft expenditure assumptions, again, are a place where there might be something that you want to pick up on if any of those things need attention. I see Commissioner Jacobs.
Martha, I was going to just suggest maybe we could just go through each of these one, two, three, four at a time and see if anybody has anything they want to discuss related to each of those. I didn't know how you were going to tackle this, but I think this is really important to have a robust discussion about each of these four sections.
Yeah, and that how robust a discussion we get to in each one. Let me ask as we're looking at the budget development framework, item 1 about evaluating return on investment. This seems fairly straightforward. Is there anything there that gives commissioners some pause or some desire to delve into? Are there any hands up on that?
Martha, you the moderator, we paying you. So however you want to work with this information is how I'm going to work with this information. I agree that a lot of it is straightforward. You all might be trying to figure out why I'm quiet today. It's no disrespect to anybody. I read the materials last night. I know how budgets work. So I'm not being quiet just for quiet's sake. Some of the questions, yeah, I got the answers too. So it's, I'm letting my colleagues have this time. And when I have a question, I'll ask it. And I respect my other colleagues who've remained quiet during conversations that I wish they would talk about. I respect that. So the silence is not people wanting to rush through. We might actually understand it. So I'll let you handle this part of the conversation, Martha. Thank you.
Beautiful, thank you. So I'm not seeing anything on the first section. On the second section, I think my suggestion is it would be appropriate to have a discussion on willingness to consider a tax increase. Is that something that the commissioners would be willing to discuss? I'm seeing some nods. Yes.
Martha,
Yeah.
I think we discussed that already, and we were asking the staff to come back to us around the tax for Mecklenburg County provide. A lot of it was contingent on that. I think we've already discussed it.
It could be, maybe perhaps I may have missed that.
I think that this one is like overall, Brenda. Yesterday when county manager, he said, as we get ready to prepare for this conversation, he wanted to take everybody's temperature and see what our appetite was for a potential tax increase. This is from my understanding, the way I'm reading this, everybody pretty much nodded yesterday that they agreed that we would have this conversation today. So it's not about the TAG program or any other programs that people are trying to push forward, but overall, what is the appetite for the 5 people on this board about a potential tax increase? And I'm gonna say this was as respectfully as I can. The fact that there were people early on that really needed to have both today and yesterday a plan put in front of them about what 1 cent and 2 cents and anything else was. I would hope that maybe this is a time that some of you all will speak up, because I'm holding my peace on that one. I just think that that's some information that some of us should have known. Maybe this is the time, now that you've had that revelation about the information, you could opine about how you feel, since it was new to you today.
Martha, this is Wendell. Can you hear me?
Yes, absolutely.
Yeah, so, the driving point here for certainly me and the staff in preparing this recommended budget is the fact that, as you've heard already, we're about $20 million out of balance. That's as of the requests that have effectively come in. I'll be sitting and I will be meeting with those respective departments to talk through those items in particular that are on their request list. At the same time, it is important to understand that, again, Keith has already showed you another list that highlights and illustrates the fact that you have already made some critical decisions around funding certain things for next year that will have an impact at the base budget level. So those are things that we've already committed to. We have to do. We have to pay insurance and health benefits for employees. We have to fund the $15 an hour. and so on and so forth. And so this conversation is pretty critical because, if there is not an appetite effectively for a tax increase, then preparing this budget will obviously make things easier. We also heard from the economist yesterday that our growth rates are going to be modest at best, based on what he is in fact projecting in terms of our state and regional and somewhat local economies. And it's not 2%. Quite frankly, it's about 1.8% based on the numbers that we saw from Mike Walden yesterday. So, I want to be able to make some sound decisions about how we are going to proceed forward and what is in fact on the table. Chair Howerton, the notion around whatever we discover from the Mecklenburg piece is essentially a smaller microcosm of the larger work that we will have to do to make sure that we deliver a balanced budget. Thank you, Martha.
Okay, I guess I misunderstood.
Martha, no politician wants to talk about raising taxes on a live YouTube. I mean, I don't let's just really be honest about it. And
totally
yesterday when the manager asked it, people had no problem because everybody's, juices were flowing and they were thinking about, not their own respective programs. They were actually taking the time to think about the things that we wanted to do to fix it, right? Everybody had really great ideas yesterday. We learned today for some that it's, a penny is $10 on every $100,000 for the county side. We know not for the city side. So if we want to, the hard conversation is, we already know we have a $24 million shortfall. We already know that there are things on here that we want to do to make the county better. And we just have to figure out how much pressure do we want to take. We've asked, I think, what was it, 357 in December, we've asked our departments to cut their budgets and send those to us. And they've done a decent job. Even some of the boards I've sit on, I've seen what a 3% or 5% or 7% reduction would look like. And so, with them making budget cuts and then we're still coming up with new ideas, and we already know that we put additional things that we have to pay for on there, and we still have a $24 million shortfall, and we still don't know what all DPS might necessarily need as we move into this pandemic. I just think that we need to take our political hats off and say, are we up to doing 1 cent on the dollar? Are we up to doing 2 cents on the dollar? And I just hope if today is not the day when people want to opine about what they want to do. I didn't say much about it yesterday. I went back and actually looked at that segment. I was on YouTube. Everybody on here was like, oh, 1 cent. Okay, yeah. And like this morning, it's quiet. And that's not a knock. We just were excited yesterday, right? That's not a knock to anybody. So I would hope that I do see some hands. I'll be quiet. You see Commissioner Jacobs likes it when I'm quiet. You see how she smiled just then. So I'll go ahead and let her go because I'm sure it's more important than what I'm saying. Go for it.
Let me say, as facilitator, I'd certainly like to hear from each commissioner to weigh in. Vice Chair Jacobs, though, I have seen your hand up.
I can't, with my, I look at my iPad, so I can't see if other people had their hands up.
It is like difficult even for me.
Yeah, so I don't know if other people had their hands up before me, so I don't want to, I'm happy to let other people go first, but I'm happy to speak too. Did anyone else have their hands up?
I think at this very moment you're up.
Okay.
If there's something.
Yeah. So yeah, I think this is a very, very important conversation. What I submitted in my comments last night was that I do support looking at a tax increase to fund really critical needs in our community, especially those that are COVID related. I'm very concerned about our economic recovery, especially related to people who are being most impacted by COVID. So I'm concerned about the people in the, again, if we can get the disaggregated data, but people who have been most impacted by in the tourism, hospitality, and entertainment industries, where those jobs are not going to come back online quickly, where they are a lot of our lowest wage workers that don't have a lot of job protections, and then, you know, really trying to target the job training and retraining with the most dislocated and impacted workers. And then also, again, the housing crisis, needs for rental assistance, any supports that we need for our schools to deal with learning loss, mental and physical health impacts to our students from the pandemic, continued equitable digital access. So I'm really, for me, a property tax increase would be very targeted towards these types of needs. The property, the social welfare tax relief program, you know, raising the funds for that again, because we're seeing the impact of gentrification and displacement. And when we increase taxes, these are the people that are going to be most impacted, like Chair Howerton referenced. These are the people in our community who really can't afford another $50. So for me, it's linked. It depends on what the property tax increase is for. Is really what for me is the critical issue. And pairing that with, again, the social welfare relief program that Commissioner Alam has really been really pushing on.
But there would be at least a willingness to consider it in the appropriate circumstances. Would any of the other commissioners like to weigh in? I see Commissioner Carter's hand up first, and then Alam, and then Chair Howerton.
I've never been all that shy about having a willingness to raise our taxes, you know, if there's a widespread community benefit to be had from doing so. And I think that we've talked about a number of things yesterday that would really help promote, you know, greater shared prosperity, widespread inclusive prosperity. And I absolutely would consider, you know, a tax increase. I actually was really pleased that Wendell asked us, you know, what's our position on this, and wanted to gauge our temperature, because I'm glad we're not just coming out of the box, or whatever the saying is, saying no tax increase, you know, right off the bat. I think that we should have that on the table as an option after we've looked at all these other aspects of our framework, you know, realignment, reduction here, efficiencies, all that. But especially if there are big initiatives that are cross-cutting among all of our priorities. For example, you know, you all who have seen all of our priorities now, if there's some that we all hold up as being really important, and there's no other way to implement that priority, you know, without a tax increase, then let's consider it at least. It doesn't mean we're going to do it, but let's at least consider it. And yeah, that is what I would, that's my general feeling about that.
Thank you. Commissioner Alam.
Yeah, I'm hearing a lot of similar feelings to what I'm feeling, and thinking through this entire process. And as Commissioner Burns said, no one wants to, well, you know, talking about a tax increase is a really difficult situation, because some of us have had like the lived experiences of the people who have that the greatest impact of the tax increase, and some of us haven't. And so it is a really difficult conversation to have when you're balancing both sides of that on a board. The places that I agree is that, you know, with having, I thank you to, as Commissioner Carter said, thank you to the manager for bringing this to us as a very clear and open conversation for us to have. Again, like when we look at the priorities that all of us have and discussing a tax increase to support these priorities and what we've already promised, I see a lot of them aligning with services for that directly benefit our community members and directly ease the burden in different areas for our community members. And when we're able to balance it with that, I do see that, you know, a tax increase could be beneficial to provide these essential services to our community members. And I do believe that they are essential. So in that arena, like I am open to this conversation and discussing it more.
Thank you. Chair Howerton.
Thank you, Martha. So, you know, this conversation I'm torn with people coming out of this pandemic. And when we think about our priorities, it really doesn't mean squat to people that are, our priorities doesn't mean anything to people that are dealing with that they don't have the resources. So I am torn with weighing this conversation out right now. So I would like to give staff an opportunity to come back to us with numbers and what it looks like, because we know there are people in this community that 1 cent on a dollar, it means nothing, means absolutely nothing. But there are people in this community as well that $50 means something. So I really want to give the staff an opportunity to come back to us with what does it look like for the least of these, that we don't put the weight of our priorities on the people that really can't afford it. And there are, and we know, and I know that there are things that we want to get done. But I'm curious, I am interested in the health and well-being of all of our community members. So that's what I can say right now is I really want to give the staff an opportunity to come back with some numbers for me.
Respectfully, Martha, we got, and y'all, we know that it is 1 cent on $100 on 100,000, that's $10. We know that 1 penny is going to net $4.5 million. 2 pennies is going to net $9 million. That is half of the shortfall that we have. Like, that's simple math that we can do in our head right now. So I understand the direction to go back to staff, but they have done a yeoman's job of presenting this to us already. So I say all that to say I'm open to the discussion. And I also recognize that while I do not agree with a lot of what some of the commissioners have paid for in the past, some of the stuff that they paid for in the pandemic, I'm rational enough to know that the suggestions that have been made over the past few days are things that will remedy what has happened during this pandemic, that will remedy the chasm that we've seen pulled, the gap and the chasm that has been widened with racial equity. Because I keep telling people all the stuff that we see, everybody's like, oh my God, healthcare is so bad for Black people. It's because y'all see it now. You know, educational gap, you know, whether people want to close or reopen in the schools, it's Black and brown children that are suffering because they make up 83% of the school system, right? So we can sit here and say we want numbers. They've given us everything that we need. This is now our time to go home and dig deep and figure out what it is that we want to do. Because we know that what we have without the appraisal is, I think, $4.5 million. So I hear everybody, but I feel like the suggestions that were made yesterday, I'm just saying I'm open to the discussion, and I'm happy to see that the majority of the staff is as well. And I do agree with Commissioner Long that there are those of us who have had those lived experiences, and we don't want to have to raise taxes on anybody. That is why myself, along with the attorney, along with Commissioner Long, said, how can we work to find a solution to alleviate that tax burden? Again, we can do both. I'm asking you all to just really be creative right now and think about, okay, if we are going to raise taxes, can we actually do a program that will not be called what it was called before, the program that Commissioner Long and myself were working on? We can do both if we get out of our ways. That's all I'm saying. We can do all of it.
Commissioners, just let me add one or two things. And I was making some notes here as many of you were talking. Much of what Commissioner Jacobs had mentioned during her comments, I am hopefully optimistic that through our federal stimulus package that will come down, if and when it's passed by Congress, that we will be able to use a fair amount of whatever bridge funding comes available to us to address many of the challenges that we are confronted with most immediately surrounding the crisis that COVID has in fact created for us. But there are still things that are above and beyond, COVID that in order to provide, at a minimum, the same service levels that we currently enjoy. And what I just want to get clear on is, above and beyond what we can anticipate coming down the pike, hopefully in federal and additional state funding to bridge us through this pandemic and this crisis. Those things on the ground that we traditionally engage in, that we want to move forward in. We are going to continue to work in respect to shaving around the edges, but I want to be very transparent in saying this. Operationally, we have been shaving around the edges now for about 5 years inside county government. So you're really getting to a point that we are a lean organization. And I'm proud to say that, quite frankly. That was a part of the entire strategy around designing and building in our managing for results strategy. But to that end, I know that there are still critical needs across the enterprise for county government. I still know that there are critical services that we will need to render. And, we're going to go through and, as we always have, give it our best effort in terms of making sure that we develop a balanced budget. And you'll get an opportunity to, as usual, to deliberate on that set of recommendations. But I hear all the concerns regarding where you all are, on the tax piece. But I think also I want to say a lot of things can change between now and the time I give you a recommended budget. Our growth projections can change. They can in one way or another. Great things may happen through a stimulus package, and we may get a lot more money than we anticipate, which I would absolutely love. We could also have variants taking hold and having another year just like we had in 2020. Who knows? All of it is, we're in this age of uncertainty. But with that being said, we're going to do our level best, and we are going to deliver a balanced budget. And I want to assure you of that. Thank you, Martha.
Thank you. Tough choices ahead, but that's exactly why people get elected. That's the good news and the bad news about being the elected official, that weighing all those important factors falls to you. So a difficult and challenging job, but at least I heard a willingness to at least consider tax increases as long as they are sure that the organization has gone through the rigor to be efficient, and a willingness to look at perhaps ways of giving relief where it's most needed, if that is feasible. Yeah, Vice Chair Jacobs, I see your hand up. I'm also aware that our chair is going to have to leave us in a little bit, so.
Thank you. I'll just be quick. I also want to just remind us all about the resident survey that we get every year. And for and to look at, you know, if we want to see what the community is telling us, to look at that. And we have seen over the last, I think every year that we've done it, that people in our community say that they are willing to pay higher taxes for education. That is one area. And also the concern about affordable housing and housing being at least priorities that we hear from the community about where they're willing to spend more money. And the other thing I want to raise is what the manager just talked about, which I am concerned about the impact of, and that gets back to just even the hiring freeze. I see it most in social services, and the manager knows this as well, that, you know, we've had, you know, there's a lot of stress on staff, and then we see impacts like for Medicaid, for timeliness and eligibility. We've had some issues with that because, again, when you cut back on staffing and things like that, then you get into problems with the state. So I think it's complex. And I do think that we have gotten to the point where a lot of our departments have been really cut back to the bone. So I just want to acknowledge that. Thank you.
Very good, very good. Do we want to go back to the budget guiding principles and just take one more quick look if there is anything else that you feel you need to cover today before we move on to priorities?
Say that again, Martha.
I was asking, should we go back to the slide with the budget guide, the framework, the budget framework? We talked about item 2 with taxes, and, you know, if staff, I don't think they need to tweak the words there, but they may based on what they've heard. Let's just take a quick look at that framework and see if there's any other areas where there's something that they need feedback on today, or that you feel like you need to give feedback on. So if we could put that document back up.
Give me just a second, Martha.
No, it looks up.
Is it up now? Great. Is it? Okay. Yep. Let me put it on maximum here. Okay.
So commissioners, as we're looking at the balance of the budget development framework, item 3 on revenue assumptions, it seems that that's mainly a mechanical area that staff is just saying or reflecting the assumptions, the revenue projections they've shown to you. I suspect there isn't much there you'd want to comment on the draft. I see a hand.
Yeah, I just had a question. I had included this in my email to Claudia and Keith. I was just wondering, would we be able to receive information on the non-exempt entities in Durham County, and possibly looking at, like, you know, ways that new revenue could be created if possible with them?
So I think
Commissioner Alam, can I get clarification on what exactly you mean by non-exempt?
So like Duke University, for example, looking at like they and different organizations that have more than 100 employees that aren't paying taxes in Durham County.
Commissioner Alam, what we can do, and this is a information request we've shared with the board in previous years, we can show some data about the nonprofits that fall in that category. And I think that will help you get some perspective. So we'll do that as an information follow-up.
Thank you.
That's a great question.
And I saw a hand from Vice Chair Jacobs.
That was a great question that Commissioner Lom just brought up. And I don't know if this is really so much for this budget year, but in terms of revenue, there have been a number of issues that our board has, asked for us to really look at that, we haven't really followed up on, which are, looking at things like our cost share with, joint departments with the city, our cost share with stakeholders like Duke for EMS, and for the city, I'm talking about the 911, planning department, GIS, some of our joint departments, whether we're paying more than our fair share, and then, also digging into, for instance, Duke's support for EMS, which they benefit from, so I don't know, it may be another conversation, but looking at what are other ways to, to generate revenue, frankly, for county services that we're providing. And even the Durham Pre-K program, $15 million bill, we can't cover that. We need stakeholders like Duke and our major employers to really help support this, like we see in places like Charlotte, where we see big institutional partners who are helping to fund major county initiatives. So these are, I don't know, it may not be for this framework, but just these types of things I think we really need to look at in even what Dwayne has started with the nonprofit fund out of the tax department that's, to help with the tax deferral program. Other communities use nonprofits to help pay for county services. And, how can we expand that fund that the tax department has just started? So those are just, some of my thoughts about how we generate more revenue for the county.
So, Martha, let me weigh in on part of Commissioner Jacobs' commentary. So she raised the issue around interlocal agreements and subsequently work that had not been done there. First of all, particularly for the new commissioners, I want to make sure that we are in fact clear about what that entails. Better than a year ago, we began the process, Tom Bonfield and I, to go through and reevaluate at the request of our board, all of our interlocal agreements for the express purposes of making sure that there was an equitable share in respect to cost. We began that process, and as a result of starting that process, two things happened. The first thing that happened that was major to that work was the city coming back and subsequently in writing indicating that if we subsequently was going down that path, they wanted to renegotiate our resolution on sales tax split. Keith shared with you yesterday essentially the new resolution that we negotiated. But long story short, here's what it amounted to. Had we not been able to negotiate a new resolution as a result of our push to get all of the interlocal agreements reshifted, the county would have effectively lost about $5 million in sales tax revenue. So then we got heavily involved in trying to renegotiate whether or not we were going to remain in the resolution with the city and subsequently not take as big a hit on our sales tax distribution. So subsequently, we did renegotiate it to get the new percentage, and it ended up costing us about $1 million as opposed to $5 million in revenue. Now, we still did the work in respect to looking at the interlocal agreements. And subsequently, when the pandemic hit, our focus shifted. And we will go back and we will essentially visit that again. But I would caution that having renegotiated the sales tax resolution, we renegotiated that resolution for a shorter period of time, which effectively means if we go back, have those discussions, and if the city comes back and say, well, we're going to get out of the agreement altogether, then what have we gained? Well, we're back basically in the same position we were a year ago when this request was made. So I want to be clear about that because Commissioner Jacobs has raised this on a couple of different occasions, and I want to make certain that the full board understands the framework and that, you know, all of the facts are in fact on the table in terms of why we are where we are as it relates to sales tax resolution versus interlocal agreements. And again, we'll revisit those conversations with the city administration as we proceed. Thank you.
I see the chair.
Just to mention as well, you know, I've been here too, and I heard that conversation. Commissioner Reckow, that was on our board, brought it up several times, and she particularly wanted for the staff to look at the split between the planning department, given that we don't do as much in planning as we used to. So that conversation kept coming up, and I know that it didn't equate to good results for us. So it's been looked at.
So it's my sense that staff could certainly, you know, tweak the either framework or guiding principles that may be in there. Looking, you know, you're looking for an equitable share from partners as kind of some general principle. But what I'm hearing is it's not too likely that any efforts right now are going to improve the prospect for this coming budget year. We're a little tapped out.
Well, I think what we're saying, Martha, is that we can make it worse.
Well, there's the potential there for us to make it worse, but even in going through the whole exercise, again, you know, what we're talking about is not going to solve a $20 million problem. It's not going to solve a $10 million problem. It's probably not going to solve $1 million problem.
Absolutely. So that when you're looking at bridging the anticipated gap, you know, there may be a balanced set of solutions that could possibly include, you know, tax increase.
Martha, can I just say real quickly, I'm going to have to go so I can get ready for the next call. Thank you so much for leading us in this process. You do a great job every time you come to us, and we appreciate you. My board can take it from here. I've got to jump on the next call. All right. Take care. Bye.
Take care. Commissioner Alam, I saw that you wanted to make a comment.
Yeah, I just had a question. And this I don't want to overburden staff. So if this is something that would require too much work, I completely understand. This was just for us to show the public, but also for ourselves. Is there a way to put together, as you're bringing estimates of all of our budget priorities and policy priorities, to make a unicorn budget? of something that encompasses everything that everyone is asking for so people can know what the true cost of that is?
We can do that. Yeah, that's a great comment. And we can definitely do that. We may get run out of town when she's.
I'm laughing with Claudia, not at you, Netta. I'm laughing with Claudia.
And I as well, when I'm imagining what that grand total would come to, it would be astounding.
They would be at your house, Netta, like Commissioner Long.
Yeah, but we definitely can, and some of that you see with the requested budget. That's so when the board gets the budget document, and Keith showed on sort of where the gap is, you will see some of that. We let departments present their budgets as they'd like, although it is still measured because many of them know that we just don't have the dollars. So that requested budget will show the bigger picture. Now, there may be some policy items that the board would like to see that may not be in that initial number, but we can definitely add that on and show what that would look like. So that's not a request that's too far out. It also tells a story to the public of what the true needs are, and help you communicate just the challenge you have in balancing this budget at the end of the process. So we can make sure we describe it in a way that tells that story and presents what the needs are. And something that Martha always reminds us of is what type of service level are we buying for our dollars in serving our residents.
So looking at the time, I'm going to suggest that we've probably spent sufficient time on the budget framework. I know there's some of the things with expenditures, assumptions you could get into. I'm going to think that those would be relatively minor. I do see one hand up. I do want to have some time to go to the incredible spreadsheet of the different priorities that were generated, just to give the board a peek at that and the magnitude of that.
Martha, can you see it?
I can see it. My eye doctor is going to be seeing me shortly after this, I think.
I can make it as big as possible within reason here. Let me just state real quick what we're looking at. So what I tried to do last evening, David and I, was take the various commissioners' many priorities, a few more than 3 for each, but that was not surprising. There's a lot the commissioners want to do. And what we tried to do was take some inferences and say, here are some major areas. So there's the budget area, the policy area, and the CIP area. And then when each of those 3 areas, we tried to do it by themes, different comments from different commissioners by theme. So under the policy area, there's a area called a theme under budget development. And these are different comments that different commissioners made around budget development that are sort of policy oriented. COVID issues are themes that are policy oriented. And you keep scrolling down, and then there's a budget area, and that's specifically issues around the budget itself, as we defined it in the budget office last night and trying to group this. Please forgive us if we made some faulty assumptions, but we were trying to give some grouping so there would be some thematic continuity from commissioners, especially if we saw things multiple times. Like there was a couple of requests for the sheriff to get a data analyst, and you might see that under new position, Sheriff's Department transition, school resource officers, analysts for better data. And another commissioner wrote, I would like to see a data analyst. So you can see how this is thematically talking about new positions under the budget or policy issues, and now we can go through this. So I'll hand it back to you, Martha, and we can see it however you want to see it, or commissioners want to see it.
Yeah, could we take just a, yeah, this is an awful lot to take in. We had, again, 52 items that came up, but I think the most important thing, there are some areas of overlap.
Absolutely.
Yeah, absolutely. And, you know, if we,
in areas of overlap, there was definitely a couple of folks who talked about property tax relief. In terms of that as a priority. Obviously, there were a couple of folks who talked about the new positions in the sheriff's office. There was definitely different talk about workforce training, at least as defined. There was a couple of different questions about youth-related issues and childhood trauma and intervention for youth creating violence in the community. I'm looking through here. A couple of different commissioners spoke about infant mortality and dealing with issues related to that.
Keith, another area that seemed to be frequently coming up was the thing we've heard throughout is the racial equity component that we all need to focus on.
Yep. Definitely racial equity was one that funding of a Black Chamber of Commerce at a minimum, the same level as the Durham Chamber. Make sure there were a couple that wanted to make sure we saw everything through the racial equity lens. I know specifically we heard Commissioner Howerton talk about that. One commissioner about a minority and women businesses enterprise office appropriately staffed and trained. And this again, now, I last night had to try to put some of these things together thematically. If someone doesn't feel like this is a racial equity issue, but some other issue, that's great. I'm happy to change it. I was doing this on the fly last night. But those were some of the discussions around racial equity. And I'm happy to send this spreadsheet out to all commissioners to take a look at. I see Commissioner Burns' hands up. Yes, ma'am.
No, this is just really quick because Commissioner Jacobs brought up a survey a second ago, and I just saw somebody's point about the school resource officers, and I do know what just happened in LA County. I would also bring up that over the summer and or the fall, if I'm not mistaken, they did a survey with teachers on how they felt about the sheriff's deputies. And we saw overwhelming support from teachers and parents that they wanted to keep them in there. Now, that's not me saying it. I'm just saying I would urge people, if we're looking at surveys, don't just look at our surveys. We need to look at DPS's surveys and look at what some of these folks asked for and what they needed. And I see, and I'm again not knocking, we're looking at this eviction and aversion program. I would also go back to something that the manager said. With this stimulus package, you know, we know what the numbers are, you know, the 300 billion in set aside just for counties. We know how much money was set aside for eviction diversion. We know $700 million is coming directly to North Carolina, but I would caution because we've seen a lot of requests come in about potential lawyers doing that work. And I would caution every person on this call. I know some of you are pushing it. There are attorneys that are being pushed that do not have success in eviction and diversion work. And before we send millions of dollars as these requests have been made, I would respectfully request that if you don't know the research behind those attorneys, go and do it yourself before we start putting, because some of this stuff, you know, it's not, I'm surprised y'all got 52. I tried to respect people's time, keep it to a sentence or two. I felt bad that mine got in late, so I apologize to Claudia and them, but 52 is a lot. And just some of these, I can clearly look at them and see that these are requests from the public. When the public is just asking you something, as the public official, we have to say, it's incumbent upon us to do some research even before we give it to the staff. Because what we did was just take somebody else's idea, say that it sounds good and give it to the staff when we haven't thought about the public policy implications. We haven't thought about some externalities that might make this a bad proposition in the first place or a good proposition. So I'm looking at this right now. It's live on YouTube. So I'm pretty sure some people are really excited that they see what they sent on here. But I don't want the public to look at this and think, oh my goodness, some politician thought my idea was good enough to put in the budget cycle. When some of these, I don't know if some of they're just some bad actors on the eviction and aversion side. And I'm just going to stop there because some of the requests have even scared me, because I wouldn't give those attorneys $2 because they haven't successfully had an eviction case. And I'm going to stop because I'm on a soapbox about that. And I hope to talk to some of you commissioners privately about that later.
Much appreciated. Just as a caveat or reminder to anybody that might be looking at this for the first time or wasn't here yesterday, that these are reflections of commissioner top priorities. We absolutely know that there is not capacity to fund all of these. I mean, that's an absolute given. I did want, with everyone's permission or concurrence, I would propose that we go back to the list from yesterday, which was each commissioner stated a top priority. Yesterday, I would suggest we could give anyone who wanted to make an adjustment in hers an opportunity to tweak it during this time. I see a hand, Commissioner Jacobs.
Thank you, Martha. And first, I just wanted to thank Keith. This is amazing that you were able to even synthesize everybody's list.
To see the pivot table and all. Oh my gosh.
Yeah, to try to make sense of everything. Thank you. And I look forward to all of this being sent out to us. Martha, I actually really just had a comment related to number 4 on the framework before about the draft expenditure assumptions. The only thing that I really saw missing from that list was that we didn't have anything about just the realities of COVID and just addressing ongoing community needs related to COVID. To me, that should be one of our underlying assumptions, is that we're going to have some, we've got some special circumstances around the pandemic that we've never had before. And that, to me, should be part of our assumptions, that we're going to have to address needs. Hopefully we will get a lot of money from the state and federal government, but if we don't, that's going to be something that we have to look at. So that's really my only comment. And I also want to clarify the county's eviction diversion program that we run with the city pays for the legal aid attorneys, and Durham County DSS.
I know that, Commissioner Jacobs. I know the breakdown. So you don't clarify it for me. Say you clarify it for the public, not for
okay.
Me.
So for the public, our Durham County dollars fund the staff positions. There are 2 staff positions for coordinated intake, and we also have funding for the emergency services for rental assistance or utility assistance. So our county funding is for both the staff and for the actual direct funding. So for the public to know that. Thank you.
Very good. Very good. So we are with 15 minutes left in our time together. I know that there have been a lot of continued conversations about priorities. I know that there is great awareness of the challenge in balancing the budget. I think it might be appropriate at this time, if does any one of the board members have any tweak or change to your reflection of what is the most important one thing? I recognize Chair Howerton had to leave. So we've got 4 of the commissioners. So my question is, does any commissioner want to either make any changes or reframe it? I know a lot of thought, and I'm not suggesting you do. I know a lot of thought went into these yesterday, but just giving that opportunity as we're trying to give guidance to staff as they put together a recommended budget, and also hopefully look toward some more unified budget priorities. Commissioner Alam?
This is just a more technical thing. For mine, number 3, I would just see that it would change tax wellness program to like tax welfare program. That language change. Thank you.
Very good. It's amazing what autocorrect can do to you. The words that it can come up with, yes. Any other adjustments? I know that each one of you stated what was important individually. Is there any sense of what might come to the top of the list out of all of these? Is there any commissioner that would like to speak to someone else's priority as being one to elevate?
I had a comment to that.
Mm-hmm.
I feel like they're very interconnected with each other, that they kind of each individually also uplift each other. When we talk about easing the tax burden, that has a greater impact on people of being able to support their children and increasing the mental health access and for our children. And we have targeted back to work initiatives and job training that also helps relieve people's tax burdens if they're able to seek access to higher paying jobs. When people have are able to seek better healthcare opportunities, we're going to see a reduction in infant mortality, but there's also obviously going to always be that need for that extra support from the county to make sure it's not disproportionately affecting Black and Brown children. And, you know, the improved prosperity as well, when we have increased access to a quality education for people across each stage of their life, from pre-K all the way to continued education, their lives are going to be improved. So yeah. I'm really excited to see like how all of us, we seem to have the same like foundational goals for our county and for the people of Durham.
It does strike me as I look at your list, there is understandably a great emphasis on COVID recovery and helping individuals and families, whether it's mental health or back to work or education, really come out of this and find thrive.
Martha, real quick. And it's a lot of us, it's odd when I sit back and I think about something that Commissioner Long just said. For a bunch of us, we actually, even back on the campaign trail, getting people to work was a real push And I think it's just been exacerbated by COVID-19. So I feel like that's something that all of us, we will be able to strategically work around. You said, what are some things that other people might have done on here to lift up? I remember Commissioner Vice Chair Jacobs brought this up on yesterday. But it is, if I could make it my number one, it really is, one of my it's always been a high priority for me. It's one I beat the drum on, and just retraining and, something that Dr. Buxton or President Buxton said last night. It really, I don't think that we have people who are unskilled. We just have to get them reskilled. And I think we have to, just change the way that we talk about it and how we enter into that space. So for me, even when I walk around now, it's just not raining so much on days it's not. And I go into the shops, and the issue is we do have shopkeepers that say, oh, I wish I could get a person in here. So that is not even a skills gap. Now we just have a communications gap. And the first thing I had somebody to ask me was, are you all going to be focusing on people who didn't have jobs before or the people who lost jobs now? And I sat and I thought about it, and I was like, we have got to focus on both, because initially I was very focused on the underemployed and the unemployed. And so that definition has changed now. And I think we get criticized a lot for the jobs that we do bring in. And I'm here to tell folks we are a magnet for those industries, but that does not mean that we're not open to working to build those. And for me, small businesses, and I end here, the backbone, not just in Durham, but just in the United States, the economic driver for any community is your small business, and they create the most jobs. So, there's some things on here. We're not going to always be able to lean on private industry or public industry. We are going to have to start to work with our people on an entrepreneurship focus, right? So that they can continue to create things. I said this the other day, I hope it does not get me in trouble because it's a comment, but there's an axe throwing place in Durham. There's a place where people actually pay to throw axes, right? And so I told
not in the budget?
No, we can't put it in the budget, but I'm saying, like, what so many times people in this community think my idea isn't good enough. There's a place where they throw axes. So I just want to communicate. Your idea is good enough. There are two young men on Andrea Street. They have a t-shirt shop called The Nest. They both lost their jobs during the pandemic. And they work with self-help to open up a shop. And it's a great shop that makes t-shirts. And somebody broke into it the other day. You know what they did? I drove, but they were getting the window fixed yesterday. We have these great entrepreneurs that are being produced right here in Durham during the pandemic. So I want us to focus on the job creation. Doesn't have to be what we bring in, it's what we create.
And so that focus on workforce, job creation, are those themes? I know we're just about at the end of our time. And the other commissioners, is that something you could live with as far as putting to a priority? I saw a thumbs up from Commissioner Jacobs, from Malam, from Burns. Commissioner Carter, was that a yes, or you wanted to phrase something?
I'd just like to speak for a minute. I mean, I basically totally agree. I tried to pick a really big area that included a lot of different aspects of education, and that would certainly be job training, retraining, workforce development, matching the skills of our workforce with the employment opportunities that are bound here, so absolutely. If we want to me, if you pick something big, you get to have more than one priority bundled in. So
absolutely. But I am glad that, all of these are incredibly important things, but putting that additional spotlight on one area, I think will help the staff and the community. I want to recognize we have 5 minutes, and I want to ask the manager if there are any closing things he wants to say and any closing remarks from commissioners.
And Martha, I'm sorry to jump in here. I actually have something at noon. So I'm unfortunately going to have to I'll just leave in a minute, but I just wanted to say thank you to you and all the staff and my fellow board members. It's been a great discussion. Thank you so much.
And so are there any closing comments from any other commissioner?
Thank you to you, Martha. You're awesome.
Oh, well, I don't deserve nearly the thanks that your hardworking staff does. I'm amazed and appreciative. I see Commissioner Carter, you want to say something? Yes.
I also want to say thanks. One thing I really found so helpful and so I appreciate it so much is that our budget materials were all in one space and so easy to find. That makes it easier for us to be good board members. I really appreciated that. And I know it's hard to pull everything together in time to get it all in one space. It really helped. Thanks for that. And I think, Martha, we're not the easiest crew to work with. I think you've really done a good job of helping us be as productive as possible.
Oh, you wouldn't know the places I've been. You guys are commendable. You're wonderful.
I just wanted to add also onto this graciousness to the thankfulness that we have for you. I definitely do see that, like, this entire process. Well, for me, this is our first budget retreat, and I know Commissioner Burns has worked on humongous budgets. So she's been through many budgets. But for me as a new commissioner, I'm extremely grateful that we were able to have this process with you of not only just keeping the meeting going and flowing. It was really helpful the way that you would take what we said and kind of like summarize it. So that way it was properly documented and followed up on it. And that really helped the flow of the conversation. And thank you to all of our staff for doing all the pre-work also with me and Commissioner Burns to get us prepped for this. We've had a lot of orientations together with staff individually, and it's been extremely helpful to come into this meeting with that. Thank you.
Any other closing remarks? I know I wanted to leave at least a minute for Wendell.
Well, Martha, I don't have much to say other than to certainly thank you for coming and helping us through this process. For the two new commissioners, Martha has been with us for a little while now. She certainly helped us get going on our managing for results work and framing that model. And just for the record, Martha and I started doing this kind of work together about 25 years ago. And so
we were 19, right?
We were both 19. So it's been a very long-standing sort of professional relationship. And when she says she's been some places that you couldn't imagine, that's the absolute truth. So take her for her word at that. But she is certainly an authority in this space, not just here along the East Coast, but across the country. And so I want to thank her for her adroit facilitation skills. I also want to thank the commissioners for their time and attention. Obviously, this is some of the most important work that we do. This budget document is a big old policy document that sort of lays out a framework for who we are as a community and what we, in fact, stand for as we sort of lay out our priorities. Obviously, when you have so many critical needs, the priorities feel like they can bump into one another. But at the end of the day, I think, when we come together as board, as manager, put our collective shoulders behind, the work that has to get done in the public sphere, we ultimately end up with some meaningful document that we can work on that gives us the ability to serve the public and to serve them well. And so that's our aim at the staff level. We will continue to have that aim at a very basic level for the most part, because it's just really about providing the quality of life for those that we choose to serve in this public space. I tell folks all the time, we pick our careers don't pick us, and we may we all made conscious decisions to serve the public. And nobody said that this work was easy. But what I will say is it's noble work. And so, again, I want to thank everybody for their time and attention. And we look forward to delivering a balanced budget. We will have ongoing discussions between now and then on some of these critical policy issues that have in fact been raised. We'll come back in April and look forward to it. And most importantly, Commissioner Alum, when we get to the deliberations, we'll get to discuss some of this stuff all over again, and we'll deliberate, and for those things that we can't do, we'll put them back on the shelf. And I can assure you, just about after 30 some years of doing this work, you'll see them again next year. It's just the nature of the work. And so, Martha, again, thank you.
Thank you all. It's been a wonderful day and a half. I really appreciate the time the commissioners give to this important work.
Thank you.
And we're at noon.
All right. Take care. We'll be in touch.
Bye-bye. You all take care.
Thanks.
Bye.